Good afternoon, everybody. Thanks so much for joining us for The Doctor Is In on WKRG's Facebook page. I'm Devin Walsh, and I'm joined by Dr. Reese Jones with the Southern Cancer Center. Dr. Jones, thanks so much for being with us.
Glad to be here.
All right, so if our director can just switch over the audio a little bit, perfect, so we can hear a little bit better. We're glad all of you are joining us today, and this is the opportunity for you to ask Dr. Jones any questions that you might have. Today, so I'm pulling up all the questions on my phone. Dr. Jones, don't think I'm just looking at my phone.
No, that's all right.
I'm hoping to get some questions from many of the folks watching today. We want to talk about cancer and coronavirus. Of course, coronavirus is a topic that everybody's talking about right now, and the vaccine is here, and so many people are eager to get it. Some people are hesitant to get it, and we want to talk with Dr. Jones about what you're hearing, first of all, from your cancer patients about the vaccine and the questions you're getting.
Well, most of my patients are very eager to get it.
Okay.
You know, there's, of course, been a lot of fear about the vaccine and whether you could catch the virus from it, and that does not appear to be the case. And I strongly encourage people to get it. Of course, in my patient population, they're much more susceptible to these infections than the average population. So I strongly encourage the vaccine, and it seems to be extremely safe.
Oh, that's good. And so you were saying, you know, some of your patients are in the group that's been able to get the vaccine, and excitingly, the governor just opened up even more groups starting February 8th, so even more of your patients will be able to get it.
Correct. And of course, one thing I was excited to see was the teachers will be allowed to get the vaccine, because of course, you know, we have a lot of younger women with breast cancer who fall into that arena, and you know, so the more people that can get it, the better, the safer we'll all be in the long run.
So you are not seeing any additional side effects for people going through cancer treatment who are getting the vaccine?
Not at all. You know, people without cancer and with cancer seem to have the same thing, a little pain at the injection site, maybe some mild symptoms, including some pains and aches and fever, but nothing severe, and I've not heard of any real severe reactions from it.
And so there are no indications not to get the vaccine if you're getting chemo or radiation. Nope, it's safe for all these people.
No, the guidelines say for cancer patients they all should get it. The only thing is if their immune system is terribly suppressed in the middle of a chemotherapy cycle, we want to wait until their white count has recovered to an acceptable range before they get it. Okay. In terms of surgery patients, the guidelines say to wait a few days after a major surgery before you get it. Okay. But there's really not much in the way of strict guidelines that keep you from getting it.
I know a lot of them probably are eager to get the vaccine because they have been quarantined since March.
Yeah, and that's the only way we're going to get out of the quarantine, to be quite honest, is either people getting infected or getting the vaccine. Obviously, I would prefer people to get the vaccine instead of the infection. It's a controlled environment, and it's 95% effective at least, and that's the only way we're going to get back to some sense of normalcy, is cycling through this disease, getting to a point where we can all get a vaccination every year and then be much safer than we have been in the past.
So most of the people you are seeing are wanting to get the vaccine?
Correct. Very few are scared of it. That has gotten better over time. In the beginning, people were very afraid. You know, and I mentioned this to you, unfortunately this vaccine came out in an election year. It got politicized a lot. There was a lot of fear out there about the vaccine. Studies have been done. This vaccine, in my opinion, and from what I've read, is safer than other vaccines out there, including the flu vaccine, and I'm a huge proponent of the flu vaccine. It's not a virus. You're not inducing a virus into the patient. It is an engineered RNA a vaccine, and very safe. Right.
I know there is a lot of misinformation, and a lot of people say, I don't want to inject the coronavirus into myself, and that's not what they're doing.
You're not doing that, and of course vaccines typically are you're injecting a component of that infection into the body. It's completely different here. This is basically, I think, going to advance other vaccines as well, and there'll be more engineered vaccines in the future for all diseases, and I think this coronavirus or COVID vaccine is on the forefront of that.
All right, so we're getting a question here from Lori. She says she has multiple myeloma. Do I qualify? I've been in remission for a year, but receiving immune globulin each month due to immune suppressant.
Yes, she would be the perfect patient to get the vaccine. Of course, myeloma itself suppresses the immune system. Past treatment suppresses the immune system. She's getting IVIG, which means her immune system is chronically suppressed.
Okay.
She would be the perfect and one of the most appropriate patients to get that vaccine.
All right, so Lori, hopefully you'll be able to get it soon, depending on how old she is. We talked about February 8th, 65 and older, or yeah, 65 and older can get it. It's been 75, now it's 65, and a lot of other categories have opened up. If you were watching WKRG News 5 at noon, you probably heard about teachers, child care workers, grocery store workers, transit work. I mean, there's a whole list of categories, so we encourage you to go to WKRG.com and see if you fit into one of those categories. I'm trying to fit into one of those categories myself. I'm ready to get it, but
Right.
it's been limited, so not everyone has
Correct.
been able to get one so far. And that's the hard part too. Is probably for you, your patients
they
want it. And they're
They
waiting.
want it, and we'll be getting it. We'll be able to administer the vaccine. We just don't know exactly when.
Okay.
We're able to administer the flu vaccine every year. We will ultimately get our allotment. It's just a new process, and there's a lot of hoops to jump through, and I's to dot and T's to cross, and getting to that point where we can administer it in clinic. We will get there. We just don't know exactly when.
Okay.
But people are eager to get it. They know what this virus does. And they don't want to get it.
Well, and that would be great for you guys to have the vaccine because they wouldn't have to go to some mass vaccination
Right.
event because you don't want them to have to do that.
Well, and if you look at the guidelines, cancer patients should be at the top of the list, but it's just, like I said, it's a logistical problem right now that we're trying to work through, and we will work through it. It's just going to take some time to get there.
All right, so Lori, who we were speaking of earlier, she's 64. She'll be 65 in June. Lori, I think she should hopefully be able to squeeze
Lori,
on in
if
there
I had it,
somehow.
I would give it to you
I know.
tomorrow.
Just get your name on a lot of different lists,
Right.
and sometimes, we're hearing a lot of cases where there was vaccine left over,
Right.
and people got a call and they weren't necessarily in the category, but they didn't want it to go to waste.
Right. Yeah, and I've heard a lot that there's a surplus, and they're again where there's a surplus, trying to get it to places that don't have the vaccine, and trying to, again, figure out the logistics of that whole process, and we're going to get better at this. But to be honest, we're less than a year into this whole thing.
Right.
We're a lot more advanced than I thought we would be, to be quite honest with you. So I'm pleased with the progress we're making, but of course we've still got a long way to go.
Right, right. Okay, so let's see. Charles is saying he is 66. He finished chemo in June of last year. Am I a candidate for the vaccine?
He's definitely a candidate, and based on this, I think the day was February the 8th. He will qualify for that vaccine. So, yes, I encourage everyone to get it. Anybody with especially an active case of cancer, a recent case of cancer, a recent case of treatment, really needs the vaccine. Again, I think 100% of people that qualify should get it based on age and other factors.
Okay, we're getting a few more questions here. Betty, I am 60. I think she's 64. Free of cancer, still have one more year. Will I get one? What do I do? I think she's saying because she's not 65, she's 64. I mean, we're seeing these categories open up pretty quickly.
Right.
She may have to wait, but again, maybe.
I think we'll see it open up, and if I'm correct, I think by the end of the summer it's anticipated that everyone will have access to it. So, while February 8th is a date that's set right now, I think things are going to be moving much more quickly over the next few weeks. So I don't think it's going to be a long, drawn-out process. But of course, until you can get your vaccine, and even after you get your vaccine, we just have to do common sense things. We have to socially distance as best we can. We have to protect ourselves, which will, in the long run, protect others.
Absolutely. I know. I feel like getting vaccinated is something we're doing for the greater good, not only protecting ourselves,
Right.
but when you think about how one person could be so contagious
Right.
and affect so many people.
Well, I mean, you look back at the flu epidemic when it first came out. It was a very similar, concept. People got it. The society had never been exposed to this thing before, and so there's no natural immunity built up. And again, the only way you build up natural immunity is either get infected with the virus or get vaccinated with the virus. And so if you can get vaccinated with the virus, now the protection's not forever. It's probably going to be a yearly thing, if not twice a year. I do. I think it's going to ultimately be like the flu. I think we're going to get it to that point. But we have to either get vaccinated or get the infection, and I know I was very eager to get the vaccination because I didn't want the infection. Most people are coming through the infection fine, but we all know or are close to people that have had bad outcomes from it.
Absolutely. Okay, so Alvin says he's 70 years old. He has received an Eligard shot. Will be starting radiation 5 days a week for 8 weeks in March.
And he would be a candidate for the vaccine. Nothing in his medical history, anything he's ongoing right now. Eligard is a hormonal manipulation, and radiation itself, there's no contraindications to getting the vaccine, even while on radiation therapy.
All right. Debbie, what about someone with diabetes, high blood pressure, and onset of COPD?
In that patient, of course, my expertise is in cancer patients who are immunosuppressed. She is definitely immunosuppressed. She has multiple risk factors, diabetes, blood pressure problems, lung problems that cause her to be increased risk for not only getting the virus, but bad outcome from the virus itself. And so I would strongly encourage that patient to get the vaccine.
Okay, this person is asking, I think that they're talking about shingles, but Charles says, does it interact with the shingles vaccine? Or I think it's a typo. It says shin grits, but I don't think that's what.
Well, yeah,
or is that such a vaccine that I'm not knowing about?
And that's a vaccine for shingles itself. And no, there does not appear to be any interaction. You can get multiple viruses at the same time or in close proximity. And I've had my flu vaccine and COVID vaccine in very close proximity with no adverse effects whatsoever.
Oh, you did? Okay. All right. Let's see if I'm missing anybody's question here. While I'm looking, let's just talk about people that have put off treatments and screenings. I mean, I know that when things shut down back in March, nobody really went to the doctor, and even I was having I got to catch up on this, and this, and you have to be really diligent about it, but I'm sure there are people who still haven't gotten caught up.
Yeah, I've unfortunately seen a few cases of people with advanced disease that would have been caught earlier 9 to 10 months ago, and I understand their fear, I certainly do, and but a lot of people are just scared to come to the doctor. They're scared to get out in the community. It has gotten better now. Of course, when this first came out, we really had a lot of unknowns. We're getting better, we're getting smarter with this thing, but I can't state it strongly enough. You have to take care of your own health. This does not change that. You have to get your screening, your health screening. You have to do everything that's right for you. You have to go see your doctor to take care of your blood pressure problems and everything else. This doesn't change that.
So you have had people that said, oh, I knew I should have gotten this checked out, or isn't that awful? And what regret they would have if they have a more advanced cancer diagnosis. Yeah, and we'll see people that are 9 to 10 months later diagnosis than they would have been. The other thing is people aren't getting their screening, and we're not going to see the effects of that now. We won't see the effects of lack of screening for a few years afterwards. Okay. So it's important to keep up with your health. Get your colonoscopies, get your mammograms, take care of yourself. The COVID doesn't change that. Wear your mask, get to where you need to go, and be an advocate for your own health. Joe is asking, why does it require 2 shots? That's just the amount of the mRNA that you're able to manipulate, the protein that you're able to manipulate. I think ultimately it will probably be a one-shot deal. The data I've seen, it's about 65% effective after 1. It's 95% or better after 2. And there again, I think it's a process that will get refined over time, and I think it will ultimately be a one-shot deal. But for now, it's 2. I mean, really, when you look at the efficacy of it, I mean, just 95%. Yeah, it's much more effective than the flu vaccine. Right, because every year the flu vaccine, depending on, it's kind of a guess. I mean, some years it's more effective than others. It is, and one thing I'll mention, I've talked about the flu a good bit. One thing that we've seen, the only positive that I've seen out of COVID, is we're not seeing much flu at all. Very little flu, and I think that's really a reflection of people being more vigilant about their health, and the masks are part of it. I'm convinced that it's also people, hand sanitizing, and that's a huge thing. Most of these viruses are direct contact viruses; they're not airborne viruses. And so, I think this has taught us a lot moving into the future of how we can protect ourselves better. Right. Okay, what have we not touched on that we really need to, Dr. Jones, about, well, let me ask you this one. Hold on, let's see another question. Mariana, can someone have 1 methotrexate to have the vaccine? Yeah, so methotrexate, again, is an immunosuppressant that's used in cancer treatment, but also in rheumatologic diseases and other things. And usually people that need methotrexate are immunosuppressed. That drug itself can immunosuppress people. There again, as long as your counts are at an adequate level, you need the vaccine. There's no reason not to get it. And a couple more coming in. Do you recommend any particular vitamins to help recover quickly from the COVID virus? No, we don't know a lot about vitamins and its effect on the COVID virus. I encourage people to take a multivitamin. I think that's the right thing to do. But in terms of any kind of high-dose vitamins or anything like that helping you to fight off the COVID vaccine, it doesn't appear to help. Because you're hearing about C and D. Right. We know that anything can naturally boost your immune system. You hear about zinc, you hear about vitamin C, all these things. No one really knows its effect on COVID. Just, protecting yourself, getting your vaccine is still the things that we know 100% are effective. And you already answered this, but we can reiterate it because I don't think Kathy heard us. Will this be needed each year like the flu vaccine? Yeah, the answer right now is yes, and I think that's going to be the way it is for a while. And I anticipate probably in the beginning it may be a twice a year. I think you may have to get a booster shot until we are able to refine it to where the vaccination lasts a year. We know that your immunity doesn't last forever. It does wane over time.
no one really knows how quickly or to what degree. So I think it will ultimately be a yearly thing is where I think it will settle in.
Okay. Well, Dr. Reese Jones has been our guest today from the Southern Cancer Center. If people would like to make an appointment with you, tell us where I know you guys sometimes go to different offices.
Right.
Where are you located?
I'm located in Baldwin County. I have a clinic in Daphne, a clinic in Foley. We have 5 clinics on both sides of the bay, and southerncancercenter.com. We're easy to find and glad to help in any way we can.
All right, Dr. Reese Jones, thanks so much for being our guest.
Thanks for having me.
And thanks so much to all of you for watching The Doctor Is In. I'm Devin Walsh. I'll see you tonight for WKRG News 5 at 5.